Welcome to the explainer. Okay, picture this. A young adult, maybe in their late 20s, walks into your office. You take their blood pressure and it's high. What do you do next? It's a scenario that's way more common and more critical than you might think. So today, we're going to break it down with a clear step-by-step guide to get it right.
All right, let's dive right into our case. You've got a 28-year-old patient, blood pressure's 140/90. And here's the kicker. They feel totally fine, no symptoms whatsoever. And that's exactly what makes this number so sneaky, so dangerous. The moves you make in the next few weeks, well, they could literally change the entire course of this person's life.
Okay, first things first. Before you even think about ordering a test or writing a prescription, your number one job is to make absolutely sure this diagnosis is real. I mean, a single high reading in a clinic, that can be super misleading. So how do we figure out if this is a temporary fluke or a true chronic problem? Well, the first thing we have to do is rule out what's called white coat hypertension. We've all seen this, right? It's where the stress of just being in a doctor's office jacks up a patient's blood pressure. But when they're at home, relaxed, it's totally normal. It is absolutely crucial to make sure this isn't what's happening before you slap a lifelong diagnosis on someone. So this makes the path forward pretty clear. An elevated office reading, that just raises your suspicion. That's the starting gun. The real confirmation has to come from outside the clinic, using either at-home blood pressure monitoring or a 24-hour ambulatory monitor. That's the gold standard. It's the only way to see what's really going on.
So once you've confirmed it's legit hypertension, the very next question has to be why. Now, in an older patient, we might just assume it's essential hypertension, but in a young adult, nope. We've got to put on our detective hats and start hunting for a specific underlying cause. And here is the absolute key takeaway. High blood pressure that starts before age 30 is a massive red flag. We just can't default to calling it essential hypertension. We have to actively search for an underlying cause, which is often treatable. If you miss it, you miss a chance to potentially cure their condition. And why is this hunt so critical? Get this. Up to 1 in 10 young adults with high blood pressure has an identifiable secondary cause. That is a huge number. Finding that cause doesn't just tweak the management plan, it can completely change their entire prognosis. Your investigation starts with a really focused physical exam. These are some of the big red flags you just can't afford to miss. Feeling a delay between the radial and femoral pulses? That could point to coarctation of the aorta. Hear a bruit over the abdomen? That might suggest renovascular disease. These simple clues you find at the bedside can point you exactly where you need to look next.
All right, next up, the essential lab panel. And look, this isn't just a random shotgun approach. Every single test here is targeted. We're checking creatinine for kidney disease. We're looking at electrolytes and an aldosterone-renin ratio for primary aldosteronism, a TSH for thyroid problems. And at the same time, we're searching for early signs of organ damage with a urine test and a 12-lead ECG.
Okay, so we've confirmed the diagnosis, and our hunt for secondary causes is officially underway. Now it's time to actually start treatment. We have to act on the number itself. Let's be crystal clear about something. A blood pressure of 140/90 is not a little high or borderline. According to the latest guidelines, this is stage 2 hypertension. And that classification isn't just some label. It's a direct command for immediate, more aggressive action. And the guidelines for stage 2 are totally unambiguous. You hit it with a 2-pronged attack. First, intensive lifestyle changes. That's non-negotiable. But second, and this is just as important, you don't wait. You start therapy with 2 different blood pressure medications right out of the gate. But hey, the work is not done once you've written the prescription. Close follow-up is absolutely mandatory. We need to see this patient back in 1 month. We've got to assess how things are going, manage any side effects, and adjust the meds if their goal isn't met. This is active management, not set it and forget it.
So why all this urgency? Why the aggressive workup and treatment for a young person who feels perfectly fine? Well, it's because the stakes are just incredibly high.
This quote really says it all. High blood pressure in a young adult isn't some problem for way down the road. It's an accelerant. It's causing silent damage to the heart, the brain, the kidneys right now, long before any symptoms ever show up. Ultimately, what we're doing here is not just treating a number on a monitor. We are actively intervening to bend the entire trajectory of this person's life.
away from a future of premature heart attacks, strokes, and kidney failure. This is one of the most powerful things we can do in all of medicine. And that leaves us with this final, really powerful thought. By taking these decisive evidence-based steps, we're not just managing a condition. We have this incredible opportunity to fundamentally rewrite a young person's entire cardiovascular future.